So moving on to the COVID-19 crisis, I mean, I think one of the first points I bring up with that is statistics seem to show that for whatever reason, people from minority backgrounds, their lives seem to be at more of a stake than white lives in the COVID-19 pandemics, in the sense that they're dying disproportionately. 181K Americans have died so far in the pandemic. The curve has not began to flatten and now is on the rise. How do you rate President Trump's response to the COVID-19 pandemic?
I think the president has done very well. I mean, if you want to do a side-by-side comparison with the H1N1 virus that hit during the Obama administration, the difference is that the media coverage of it. Again, let's go back and look at the numbers, and I'm here in Texas. One of the things we have to come to realize is that overall, COVID-19 has affected maybe about 1% of the United States population. And it really does, if you look at the numbers and understand, we've had about a 99.96% recovery rate. That's something that people aren't talking about. So there's a very big difference between people dying with COVID-19 or dying because of COVID-19. We know that 94% of COVID-19 deaths in the United States of America, this comes from the CDC, they have had some other, at least one serious medical condition. When you talk about the Black community, those serious medical conditions adversely affect the Black community: obesity, type 2 diabetes, hypertension, and heart disease. But you know, one of the things about me, I do have a heart pacemaker. I had it put in back in 2016 because I have a condition called sick sinus syndrome. But I still try to take care of myself, run, work out. I'm almost 60 years of age. 65 and above here in the state of Texas, 74, 75% of COVID-19 attributed deaths have been in that demographic. So I think that we can focus our response to those most endangered demographics, but we have without a doubt seen some draconian, some heavy-handed approaches to this. And I don't think that any elected official should be deciding who or what is essential in the United States of America, because that has really had a bad effect on our economy and especially our small businesses.
Couldn't one argue as well that part of the problem from the economic angle is because President Trump went, and the sort of agenda was to have a sort of more earlier reopening, that it's caused the curve to rise again instead of keeping it longer first shutdown, resulting in a sort of not having to re-shut down again, as we've seen in other parts of the world?
Well, I think that, you know, initially when the president said that he was going to not allow those flights coming in from China, he was called a racist and a xenophobe. He cut off that transport coming in from Europe, and he was criticized for that. But I think that was very important. And then again, when you look at initially, it was supposed to be 15 days to flatten the curve. And, you know, people had to slowly but surely try to gradually reopen. And I think that here in Texas, what we have seen is a lot of those new cases are with young people who do end up recovering. So we have seen, you know, an increase of cases. Why? Because you are testing more people, but you've seen on the other side a dropping of the amount of deaths because people are recovering from it. So I think that if we want to continue to hold ourselves hostage, one of the big issues that we're seeing in the United States of America is an increase of suicides. We're seeing an increase in domestic and child abuse. And we're seeing, you know, some adverse effects for our children who are now being held hostage with this whole thing with schools. I talk to young people a lot, and they want to get back to school. And I think that we can do the things that are necessary to protect them, especially in understanding that's not one of the severely affected demographics. Leaders,
Um,
one of the things that the military taught me is that leaders always find out what can be done instead of acquiescing to what can't be done.
uh, with the sort of, you said that more testing means more cases discovered. That is true. However, in June, the positivity rate of COVID-19 testing was in the United States was around 3%. Now it's around 6 to 7%. The daily death averages in June were about 500 a day. But in July and August, that death rate has been 1,000 plus a day. Do you think that potentially the main criticism from the sort of COVID-19 response has been that you've had this reopening that's moved too quickly, and it's resulted in now, because of this rising death rate, having to reclose again, which results in even more economic damage?
Well, I will tell you, we're not seeing a rising death rate here in Texas where I am. We're seeing an increase in cases. But then again, we also know that there's some disparities. And here in North Texas, we had a county commissioner who challenged the Texas State Health and Human Services because they were reporting his county, Collin County, at a 3 times higher rate of active cases than what is really happening. A lot of times, what we have seen so far is that this interpolation of a case and how many contacts that case could have had, and that has been driving up numbers. But again, the amount of deaths are dropping and going down. Sure, we have the cases, but then let's start talking about the recoveries thereof. So we're looking at a 0.04% uh, instance of death, which is sad. But then again, let's start talking about how many of those are, with COVID-19 and not because of COVID-19. I give you a case in point. I just recently had a pretty catastrophic motorcycle accident back on Memorial Day weekend. And if I were in the hospital and I had been tested and it come up positive for COVID-19, but then I had passed away because of the injuries of my motorcycle accident, we all know that one of the things that have been done, and Dr. Deborah Burke said that we are classifying people as COVID-19 deaths when we know that the real cause was something else. So again, are we so that dying with COVID-19 and because of COVID-19? There's two very different classifications.
So just, but just, but there's been a rise in death. So even if you're measuring deaths with COVID-19, if you were measuring death before with COVID-19, not of COVID-19, there's still been a rise in deaths throughout July and August.
Not here.